Good evening, all. I'm myself, Dr. Santosh. Welcome you all for Dr. K. Garwal's Med Talks 566th episode today. We are going to discuss role of gut-lung microbiota in susceptible to infection, clinician perspective. We have our eminent speaker today, Dr. B.D. Goswami. Doctor is MD Medicine, PhD in Gastroenterology and Head of Department, Dispur Hospital, Guwahati. We welcome you, sir.
Welcome.
Yes, sir. Sir, there is a lot of buzz in probiotics in the lung gut axis. So before directly into the going through this, what is gut and organ axis, how it is benefited, and what is the normal physiology, and how we have to keep it healthy to reduce the future complication and infection.
Yeah, this is a very relevant question, Dr. Sandoz. And all of us, we should be aware of all these facts, what we have got. So we have the gut microbiota, we have got the lung microbiota. So means we have got lots and lots of the microbiota in our GI tract, intestine. And at the same time, we have got the similar way the microbiota, the bacteria, the viruses, the fungus inside the lung itself. So there is the connection. It is established today. There is a gut lung axis. Means this microbiota of the intestine as well as the microbiota of the lung both have the connection. We know that lung and the GI tract is a distinct organs in the body. The similar way, we have got the other organs in the body, other parts of the body, and there are different axes existed today, and the science has already proved that that connection is very, very important. For example, not only the gut lung axis, there is also connection with the gut brain axis. There is connection with the gut kidney axis, gut lung kidney axis. That means this microbiota and the interaction in between these uh, organisms they exist, and they have got so much of role in the healthy position of the body and also in the different diseases of the body. So that is what we call that the axis between the organs. That's what we have
Yes.
got to do with the gut lung axis, as you are mentioning that we want to discuss about this particular axis. But we have got the other axes also, like gut brain axis, and lot of discussions and the established facts, studies. Already we know about the gut brain axis. We now know more of the lung axis as well.
Yes, sir. Yes, yeah. Rightly said, sir. We have gut and brain axis, gut and liver axis, gut and kidney axis, and all
Yeah.
are important. So, what you are rightly said, it is all the gut and organ axis leads to strong immunity. That's right on this side. Sir, what about
Yeah.
how it is like metabolic homeostasis? It is very difficult to understand. Sometimes intestine is in one organ and the lung is in other organ, but gut and lung axis and it is benefit. So, what are the gut and lung axis benefit for the normal human physiology?
Yeah, they have got the interaction through various pathways actually, very complex, but there are different pathways. For example, say gut lung axis, they have got the connectivity like the neural to the humoral circulation. So all these different ways they are interconnected, and that's the important thing. This the microbiome, if you see the whole microbiome, the bacteria, the viruses, or the fungal, all of them have got the interactions in between them. Normal individual, for example, in the gut, the microbiota is well balanced. it is well balanced, and that's why we have got a healthy, system we have got. But whenever there is the imbalance of this microbiota, because it's billions of the bacteria or microbes are inside the intestine. Similar way in the lung. Of course, we are better to know about the gut microbiota, because for long years we are doing studies on the gut bacteria, gut microbiota. But for last few years, we have got so many works also on the lung. So lung is a new thing for us for the lung microbiota, but it is a whole thing for the gut microbiota. So this well balance is important, whether it is lung or whether it is your gut. So whenever there is a disbalance of the good bacteria or bad bacteria, in simple way, if we know, if we think of, then there is a problem. There is dysbiosis. Normally, there is eubiosis when it is normally maintained with equal good and bad bacteria. But whenever there is the dysfunction, interaction where the bad bacteria take over or bad microbes take over or get the prominence. So then what we call the dysbiosis. Another important point I should mention here, whether it is a lung or it is a gut, this microbiota, the mass is very important one, and then is the diversity of the microbiota. These two are very important points. So whenever there is, that means quantity of the bacteria, microbiota, or the diversity of the bacteria is changed, so then there we have got the diseases, the various disease process comes in. And normally they maintain a healthy environment. There are some bacteria or some fungi which control. So, for example, in the gut microbiota, the studies have already shown that uh, Saccaro, uh, Saccharomyces boulardii and uh, S. albicans, these are fungi, which usually controls some of the bad bacteria. They inhibit the growth of the bad bacteria in the intestine so that the person has got the eubiosis, normal balance of the microbiome inside the intestine. On the other hand, again, Saccharomyces boulardii has got the capacity because they produces some of the extracts inside the intestine, and that extracts production ultimately inhibits the toxicity of some of the bad pathogens inside the intestine. For example, uh, in some cases of severe infection, uh, that's what the fact we have got. They inhibit it. So that's how they maintains the balance. In the same way, suppose there is the infection inside the intestine or disbalance or the diversity is reduced, then it has got the consequences inside the intestine. At the same time, they are as interconnected with the lung or lung microbiome, they has got the effect as well in a similar way. And most important, this microbiome, they usually controls and modulate the immunity of the body. So that's why the immunity is either decrease or increase. It depends upon this microbiome. That's what the studies are showing now. So whenever there is some infections inside the intestine, also we get some sort of infections inside the lung. So short term or long term, this microbiome has got the effect. For example, it is already established today that there is the connection of the asthma, people suffering from asthma or people suffering from chronic obstructive airway disease, cystic fibrosis in the lung. So all these diseases are interconnected and they are dependent in some way on the lung microbiota. So we have to accept it, and probably it will need some more studies, more interactions then only we can establish it thoroughly. But already it is to some extent it is established. Regarding the intestine, in a similar way, in the GI tract, this microbiota is already fully established that they have got the effect in diseases like irritable bowel syndrome or inflammatory bowel disease. Already it is established. So we cannot ignore the microbiota of the gut, or we cannot also ignore the microbiota of of the lung.
Yeah, the rightly and nicely summarize the how lung and gut axis works. Of course, sir, as you rightly said, there is a lung have a lot of microbial emigration and elimination because of the during the respiratory process. But of course, growth condition definitely depending on nutritional condition, oxygen, pH, or inflammatory condition or the weather environment. So, as you rightly said, then there is a benefit in terms of the helper cell or the CD8 for CD8 plus T cells in the gut lung axis. Coming to this, there is say that asthma you just mentioned about COPD or asthma. So you are saying that there is a definite connection between lung disorder with the intestine, like asthma, COPD, and the smoking also. It will definitely affect the lung and gut axis.
Yeah.
Yes.
Yeah, there are these are all of what I have already mentioned about the microbiome, either in the gut or in the lung. Anyway, there are some factors which actually maintains it properly. There are some factors which influence it. For example, that is what smoking. So those people who have got the smoking habit, they have got the effects, consequences on the microbiome. And that's why in the different disease process, we have got the effects of the smoking. On the other hand, suppose any type of infection in the GI tract, that they make the disbalance of the intestinal microbiome. And but for example, age is also a factor. In the young age, we have got the changes in the microbiome more intensely in some diseases. For example, in IBS, for example, in the elderly age group, they do not have that much of effect of the age on the intestinal microbiome to cause the IBS. Uh, I have already mentioned, and also you are mentioning about the COPD or asthma or cystic fibrosis in the lung disease, or for that matter, other infections also in the pneumonia and all in the lung. It is connected, yes, but very interesting topic today is about the uh, coming to the intestinal gut microbiota and the IBS. That's why earlier we thought the 1960s when we were discussing about the irritable bowel syndrome, all of us we discussed about the gut brain axis. Basically, the perception of the gut neuronal hypersensitivity, the perception in the brain, what is going on inside the intestine. So these were the matters what we call the gut brain axis. But today we are discussing more and more about the gut microbiota. So gut microbiota is supposed to be one of the major cause of the irritable bowel syndrome. Earlier, we didn't know much about it, but today it is established. And that's why one in every 10 patients of irritable bowel syndrome, they feel they have got the IBS symptoms after coming in contact with some sort of infections in the past. So that's what we call the post-infection irritable bowel syndrome, PIIBS, post-infection irritable bowel syndrome, because they already established in the science, and these patients also feel that they had the infection earlier, any sort of infection with diarrhea or with temperature and all, and subsequently they have got the symptoms of the irritable bowel syndrome coming up. It is today established that there is the unresolved GI inflammation going on in this group of patients at micro level. At very micro level, there is inflammation process going on after the acute infection. It is not resolved properly. And those patients, they used to have the irritable bowel syndrome after the infection. So similar way, today it is also established that in case of inflammatory bowel disease, Crohn's disease or ulcerative colitis, there is in question of the infections. And studies are showing and establishing also that whenever we use the probiotics in this group of patients, they have got some role. It is not, I'm not mentioning that it is the only line of treatment, but point is it is a supportive measure. If you add a probiotic as an add-on, they have got the good effects on the disease process. So these are the interconnections, these are the factors, and we have to ultimately notice about it.
Yes, sir. Yes, that's rightly said. Like any infection in the intestine, it will increase or decrease the severity of any infection.
Yeah,
You
exactly.
already discussed about asthma, COPD, but the one of the recent is that COVID. There is if that is the relation is there between gut and lung or gut and other organ axis, definitely the COVID and the severity of the COVID definitely related with the gut and lung axis. What is your opinion on
Uh, yes, it is. It is today because COVID is a new disease. Of course, it will take some more time to establish some of the facts. But some studies they are already showing that yes, they have got a role in probably in some way in the pathogenesis and the process. The process of the COVID may be related with the gut or lung axis microbiota. That's what we know. Point is, they have got the fact that those patients who have got the severe disease, maybe they have got some sort of dysbiosis, or probably they have got a decreased diversity, or the mass of the microbiome is lesser in this group of patients, and that's why they have got the severe disease process. Again, it is also seen that those patients who have got the elderly age group of patients, or those patients who have got the comorbid conditions, they have got some sort of dysbiosis in the gut as well as in the lung. And that's why those patients with the comorbid, they have got the severe disease, and also they have got the high mortality rate. It is too early to ultimately come to a conclusion about this axis, but probably it will need some more time because it is a new disease. Probably it will take some more time, more probably studies will be needed. But there is a chance that yes, we have got this axis and they have got a role in the disease process of the COVID,
COVID? Yes, sir. Yes, sir.
especially those who, yeah, especially those who have got the severe disease.
Yes, sir, definitely. Because as you rightly said, there is the other factor like old age, medical condition, or the diabetes. Definitely, there's a
Yeah.
dysbiosis in the microbiota, and along with a viral infection like a COVID, it will increase the permeability and inflammation. And definitely, cytokine storm is the one of the definite marker for COVID severity. So these two things leads to increase in cytokine storms in the human body. Whether this AC inhibitor ACE2 that is called COVID-12. So, any your experience that probiotic have role in AC inhibitor in the lungs or the intestine to reduce the cytokine storm in COVID?
I personally cannot say that I have got any experience about it, but what I have gone through the literature, there are some studies, some group they add on the probiotic, and they conclude that maybe it has got some role in in halting the process, at least the severity, because ultimately gut-lung microbiota, they have got the modulation on the innate immunity or adaptive immunity of the body, human body. It is established one. So if we can add a probiotic, probably that immunity can be raised, enhanced, and it can be helpful in the disease process of the COVID, especially in the severe disease process. And I personally feel that uh, there is no harm in giving or aiding a probiotic in this group of patients. Somehow we can probably help the patient at that particular moment. We may be 100% not sure about it, but still there is a point probably we can use it.
Yes, yes. So at the definitely you say that any altered in gut microbiota, and there is a word called associated leaky gut. So that definitely of
Yes.
yes, definitely affect the COVID
Because
severity.
it's leaky, whenever there is a leaky gut, there is the permeability is increased in the intestine. Whole disease process severity goes to the circulation, either in the lung or in the intestine. So this permeability is the enhancing disease process, and if we can somehow try to halt it, it will be definitely helpful one.
Yes, sir. Sir, previously you told there is a reduction of lactobacillus and bifidobacterium in the
Yeah.
gut. So that means that is definitely there is a benefit of probiotic, not in a COVID or maybe asthma or COPD or IBS and even the COVID also. Is it right, sir? What?
Yeah, there are some studies coming up, especially in particularly in case of inflammatory bowel disease, and it is shown that yes, this lactobacillus uh, probably has got the role in the treatment of uh, inflammatory bowel disease, ulcerative colitis mainly, and of course all the studies who have done it, they have given it an add-on therapy in case of irritable bowel syndrome. It may be ulcerative colitis, it may be even Crohn's disease. There are so many studies are showing on this particular aspect. Regarding even the COVID, there are some groups who have added the lactobacillus, and probably will get the long-term result after some years, because it is too early to comment on it again and again. I'm talking about in lung disease as well. Maybe there are some role of the probiotic, because there is a question of the lung gut axis, because there is a question about the microbiome of the GI tract as well as in the lung. And
Yes.
another important point, Dr. Santosh, about the um, microbiota. As a whole, microbiota basically it is our knowledge what we have got till today. This microbiota mostly the bacteroids, mostly, and microbiota, that means the fungus. But at the same time, we should not ignore about the presence of the lot of bacteria. Viruses, uh, of course, is there, but we don't know. It is too early for us to know everything about the viruses. But there are a lot of viruses are there in the microbiota. They have got the good effect, they have got the bad effects as well. But it will take more studies will be needed to ultimately come to a conclusion. But that part, our knowledge is very restricted one. But in the long term, probably we'll be knowing more and more the viruses are inside the lung or gut microbiota. In fact, if you see the studies, they are showing also that it itself, the gut microbiota itself, is some sort of an organ, what we call is a forgotten organ. There's so much of the mass of the microbiota is there inside the intestine, which control. the the healthy human being as well as the disease process of the GI tract or the lung or other parts of the body, maybe the kidney as well.
Yes, sir. So there is one interesting question. So what they are saying is, after COVID infection, they getting bronchial asthma and getting cold, cough, and flu symptoms, even the fatigue also. So whether it is the there may be some relation between gut lung and COVID and asthma in this kind of situation.
It's a very good, very intriguing question. The point is the answer straight away I cannot answer it because we are not sure about it. It is a experience what we have got from the patients, and different patients from different parts of the world, they have got these type of experiences coming up in the journals. But the point is there is a chance. Yes, what we are discussing about the gut microbiota or lung microbiota, maybe there is dysbiosis, and for that matter, as we have mentioned about the microbiota, they ultimately modulate the immunity of the human being in the lung as well as the intestine. So probably it is yes. For long term, we have got this suffering of weakness, then uh, cough, mild cough. So all these may be related with the microbiota.
Yes, sir. Sir, one another interesting question. See that there is a like COVID, but he does never involve lung, only the throat and sinus, like a COVID. I think third wave he's suffering. The doctor is asking, but he's the patient feeling pain and abdominal pain, but there is no diarrhea. Before it was there, now it is not there. So again, they are saying that can I use probiotic? Is kind of a patient, or I will do the some antibiotics related. Dose for this kind of a patient.
No, point is if it is a COVID one, so regarding the symptoms, we are open to everything. It can happen everything. In COVID, initially the first wave, if you remember, those days mostly it was the lung disease, mostly involving the lung or respiratory tract involvement was very very higher one. But at the same time, at least around 18% of the patients they had some intestinal symptoms like diarrhea. Sometimes there is pain abdomen also. So the first attack when we heard about the COVID, almost 1.5 or 2 years back. Last year it was also similar way, mostly involvement of the lung, but at the same time there was 20% cases involvement of the intestine is also involved. But this time when what we are talking about the Omicron or at the moment in India, what we have got the variant everywhere in India across the country, mild cough, mild temperature. So intestine, if there is uh, pain abdomen, mild pain, so definitely there is a point that we can use a probiotic initially. If there is not severe one, if there is severe one, other symptoms need, then probably you should go for the antibiotic.
Yes, yes. So regarding the same, because what is the next question? They are saying that in a COVID, there is a lot of medicine, like it may be a antibiotic sometime or the blood, B complex and all. Getting into gastritis is very common, and it is a long time. Sometimes patient may come after 2 months also. So, what is your suggestion? Can we start the and just a Rentec or some other remifenib or lansoprazole, or we just give some probiotics along with that, wait for 2 to 3 months. And again, he's saying that there is a need of any endoscopy for this patient. So, what is your suggestion?
No, no, point is, first of all, we have to identify if it is a case of COVID. So you give the treatment for the COVID. But if the patient has got later on, if he has got, or during that time also, if there is the symptoms of the gastritis or gastric irritation, there is a acid regurgitation, heartburn. So depending upon the symptoms, you can aid with PPI or ranitidine or any H2 receptor antagonist. There is no problem, and easily we can use it. There is no harm at all, no side effect at all. That is a symptomatic one. But later on, if it is the patient is got relief of the symptoms of COVID, he is completely negative, everything is fine. Even after that, if he has got or she has got the symptoms of the reflux disease continuing for a long time, then probably he will need the investigation, whether it is related with the COVID, maybe the infection he had COVID or she had COVID. Later on, he has got this problem, we should investigate. So that time it is not responding to such PPI or to H2 receptor antagonist, he may need an endoscopy to see whether he has got any GI pathology.
Yes, yes. So
Otherwise,
regarding that,
mostly you can just give the symptomatic treatment with a PPI or H2 receptor antagonist.
yes, sir, that is regarding one question like IBS. They are saying that IBS is a very difficult and some kind of different kind of a treatment is required. So, what is your suggestion to manage it? Sometimes the patient will come irregularly. No, I'm not getting benefit, even though he is on treatment. Kind of a psychologically and pathological diseases. So, how you treat it in this kind of a patient?
Yeah, this is the most difficult job for a physician or for any medical profession. It is IBS is not limited to only the gastroenterologist. They will come to anybody. Even gynecologists have to see a patient with IBS because they used to go to everyone. The point is, it is a very difficult group of patients to treat or give relief to the symptoms what they have got. And basically, that's why the line of treatment is mostly the symptomatic one. And all these, the natural process of irritable bowel syndrome, what we have seen all these years, all the studies, what they are showing, the science also they are showing, that we have to be very, very careful about dealing with their psychology of the patients. The psychology, the perception, what they have got, that is very important. Before giving a medication, you have to give the assurance, the feeling of the assurance of the patient, I mean, the doctor to the patient is very, very important one. They should be assured, first of all, that your disease is not a big issue. It is not a severe problem. It is not a carcinoma of somewhere in the body. It is not a serious disease of the body. It is a temporary one. It will go, but at the same time, you have to continue to live with the problem. It is not that completely you will be cured. That is a wrong thing for all of us as a physician to assure them that it will be completely cured. It is not cured. We have to live with it, we have to adapt with it. But it is not a serious problem. That is what actually is the need of the hour. So reassurance to the patient is very, very important one. That's why there was a very interesting study I just want to quote here. The study showed that those patients, those have got the doctor-patient relationship, is the only subject where the doctor-patient relationship is of utmost importance. If the doctor-patient relationship is very perfect one, very good one, he has come to you, you talk to him properly, give some more time, listen to him, give assurance to him that everything will be fine, nothing to worry. So after that, he will be probably feel better. Before giving any medication, you have to ensure this relationship. And those patients who have got this good doctor-patient relationship, your consultation is decreasing after that. Otherwise, every 10, 15 days, he'll be coming back to you. Yes, doctor, I have not got relief of the problem. I am going to the toilet. I have to go to any place. Before going, I have to think whether there is a toilet in a nearby. So all these points are there. That's why my first message is your doctor patient relationship. You give importance, maximum importance to that one in dealing a patient with the irritable bowel syndrome. Otherwise, most of the medications are symptomatic one. Those who have got the diarrhea predominant, you give antidiarrheal. Those who have got the constipated IBS, you give symptomatic treatment. And of course, in majority of the patients, you have to give some antidepressant, anxiolytic medications because in case of irritable bowel syndrome, almost 50% of them actually they have got some sort of psychological effect of their disease. They feel that they have got the serious disease and the doctors have not got it. They could not diagnose it. That is a problem with them. So anxiolytic medications are also having some. Then about the different type of diets also cause sometimes they feel that it is causing in trouble. You take care of that, advise the proper dietary habits and all. So that's how actually it should be managed. But my take is your doctor-patient relationship. You give maximum time to them, listen to them.
Yes, sir. Yes, sir. We will try to wind up but before that, I will, if you are okay, I will ask one or two questions. One thing is about the diet you already discussed. What are the diet you prescribe generally, especially for the COPD patient or asthma patient?
I, so that I could not hear because your voice is cracking. I could not hear
O-
what.
Okay, okay, sir. What to suggest in terms of the diet for COPD or asthma patient?
Regarding diet,
Diet, yes.
uh, it is very difficult for me to answer this question particularly because probably we should talk to some pulmonologist or a uh, physicians about the diet in case of your chronic lung disease or in case of asthma. Uh, Particularly as a gastroenterologist, it will not be proper for me to give or an advice about the diet in asthma or COPD.
Yes, yes. Sir, before closing the session, I want your suggestion or your key highlights for our audience, especially for microbiota and infection.
Again, I your voice
Yeah,
is
okay,
cracking.
okay.
I cannot hear.
Okay. I will tell you, sir. What is your final suggestion or the advice to our audience today, especially for how we have to manage microbiota and the infection?
My microbiota and infection.
Infection. Yes, sir. What is the highlight? Last point, key insight for this meeting.
Yeah, my my yeah, I go. What I have got it, I'm not sure, but what I have got it that you want me to talk on. I will suggest what is the microbiota for good microbiota. What we should do is it
Yes, sir. The
because I
highlights,
cannot
just.
properly hear. You.
Yeah. Key
Yes, yes.
insight. Oh, yeah.
Yeah. So I have already mentioned about the microbiota. It is very, very important for our healthy body, especially inside the gut microbiota. We today know a lot of the microbiota, billions of the microbiota inside the body, mainly in the intestine, and those are related with some of the immunity of our body. We should always have the eubiosis, so normal the balance of the good bacteria and the bad bacteria, because intestinal bacteria some are good, some are bad. If they are maintaining If they have got the balance, there is no issue at all. In healthy individual, it is well balanced. But in case of disbalance, if the total quantity of the microbiota is increased or decreased, or in some cases the diversity of the microbiota, different diverse diversity of the microbiota, if it is ultimately changed, then also we have got the problem with the infections inside the body, because ultimately they are related with the immunity. So always we should maintain a healthy food habit so that our intestinal microbiota is well maintained. It is well maintained means it will help us in maintaining our good health. So the diet is of prime importance. Next point is, every time for small region, we should not go for the improper use of unnecessary use of the antibiotic or the medications, because some of the intestinal microbiome is distorted whenever you take a course of antibiotic, if it is not necessary one. So infection controlled by the antibiotic also causes trouble to the intestinal microbiome. And then also we have got the trouble in our GI tract or in our body anywhere, because ultimately it is the innate or adaptive immune system is distorted. So always try to have a good habit, food habit, and that will be helpful to maintain our intestinal microbiota, which is very crucial for our healthy human being.
Yes, sir. It is nicely summarized and very simple and a very crisp message to all our audience. On behalf of this, I thanks Dr. B.D. Goswami to give the nice overview about how lung and gut microbiota has leads to infection and what we have to do in the future to reduce these complications. So, on behalf of all, I thank you, Dr. Goswami, sir, for wonderful this thing. Thank you,
Thank
sir.
you. Thank you. Thank you, Santosh, for
Thank
the wonderful evening. Yeah.
Yeah, thank you, sir. Thank you.
Thank you.